All right. Okay, so thank you everybody so much for being here for our first HeartSafe Porter County Community Team meeting. This is very exciting. For us, it's something that we've been talking about for a year and a half, but for many of you, you've been talking about for years before we ever came into the conversation. So some of you, this will be the first time that you're hearing about it. So the very first thing that we are going to do is have a presentation on what a HeartSafe community is to kind of level set everybody on where we are and where we are trying to go. So what I would like to do first is just really brief introductions. I will just pull up the people tab on my meeting and then just call your first names to just say who's there and what organization, business, or group you're representing. And we will do that real fast and then we'll get started. So I'm Carrie Geschwind. I'm from the Porter County Health Department, and I have Patty next on my list.
I'm not sure if I have this on.
I hear you.
Oh, okay. I'm from Northwestern Indiana Telephone Company. I'm the safety director here.
Thank you, Patty. Dave.
Dave Casarda, Dunlin Family YMCA.
Debbie.
Debbie Gunn, Porter County Central Communications.
Wendy.
Wendy Burbridge, Director of Development, Valparaiso YMCA.
Chancellor Sikoski.
Arthur Sikoski, Chancellor Ivy Tech, Valparaiso, Michigan City, LaPorte.
Amy.
Amy Gilbert, Chesterton Fire Department.
Allie.
Allie Smart, Tobacco Education and Prevention Coalition for Porter County.
Carrie H.
Carrie Higgins. I am the director of the Tobacco Education and Prevention Coalition for Porter County, affiliated with the Valparaiso University College of Nursing and Health Professions.
Chris. Crail. Sorry.
Chris Crail, Portage Fire Department.
Christian. And that's a phone, so they might not be able to. We'll move down to Christy. Christy Cleveland.
Well, now can you hear me?
Yes.
Hey, okay, I hit the right button. Christy Cleveland, I'm the nurse for community outreach with Powers Health, and I also have the office here at the Valpo Y.
Wonderful. Crystal. Oh, you know what? I don't think she has speaking capabilities.
Can you hear me now?
Oh, yes.
Okay. Crystal Coffey, Porter County Health Department.
Chris, go ahead.
Chris Finchie, Torino, Porter County Health Department.
You guys got Tara in there?
Yes.
Hi, I'm in here. I'm Tara. I'm at the Porter County Health Department as well.
All right, wonderful. Doug.
Hey, Doug Lang, Indiana Dunes State Park, Department of Natural Resources.
Ellen.
I'm Ellen Denton. I'm a police social worker at the Porter County Sheriff's Office.
Greg.
I think he said he was having a microphone issue.
Oh, thank you.
In the chat there.
Thank you. Sorry, I have many people up and not my chat. Jeff.
Sorry, I just popped in. I was running a little late. Porter County Health Department, emergency preparedness.
Perfect. Jennifer.
Jennifer Homan, Franciscan Health. I'm the trauma program manager in Crown Point. Also the leader of Safe Kids Northwest Indiana.
Joy.
Joy Sunday, Director of Health Services for Valparaiso Community Schools.
Katie.
Katie Sarver, Northwest Health Community Programs and Wellness Outreach Manager.
McKenna.
Director of Program with the MAC Foundation, and we also have Phil.
Got Phil. Phil.
How you doing? I'm with MAC Foundation.
Cool. Marissa. Mark.
Hi, Mark Lamont with the Valparaiso Police Department.
I see Matt.
I'm Matthew Hall, new administrator for the Porter County Health Department.
All right. And Matt Gast.
Yeah, Matt Gast, Environmental Health and Safety Manager at Urschel Laboratories.
You guys were right next to each other. Melissa.
Hi, Melissa Martin with the Porter County Community Foundation.
Scott.
Scott Arnold with Valparaiso Fire Department.
Tim.
Tim Stites, Valparaiso Fire Department.
Todd.
Todd Willis, Director of Community Engagement with Porter Stark Services.
Tyler.
Tyler McLeod, Chesterton Parks.
Now you guys will have to forgive me because people were bouncing all around, so I'm sure I missed a couple of people. So if I didn't acknowledge you, please let us know who you are.
Hi, Carrie. This is Lisa Kiger with Powers Health.
Thanks, Lisa. Sorry about that.
Hi, Sean O'Donnell, Chesterton.
Thanks, Sean.
Caroline Martin, Cleveland Cliffs Burns Harbor Operations Representative.
Thank you.
Chuck Garber.
All right, do we get every? Oh, go ahead.
Chuck Garber, Valparaiso University.
Thanks, Chuck. Is that everybody?
Willow with the Porter County Library System.
Oh, Willow. I'm so sorry. I already talked to you in the chat. That was my fault.
Hi, everybody.
All right. I am going to, is that everybody officially? Thank you all for being here. This is really awesome. I am going to go ahead and turn off my camera and I'm going to start sharing my screen. So while I am doing this, if you have any questions or comments and you want to throw them in the chat, I won't be able to see that, but Crystal's going to monitor that for us. And then if you want to say something and you just want to say it, please raise your hand and she'll acknowledge that as well. And we will address those things then. So really informal, but like I said, we're just going to start with a presentation. Oh, okay, there we go. Sorry, I thought maybe I had to do that first. Can everybody see the screen, my presentation, and hear me okay? Okay, wonderful. All right, so first of all, HEARTSafe Communities is an intervention for reducing death and disability from sudden cardiac arrest. And the group that we've been talking to is the Citizen CPR Foundation, who provides a guidance and assistance along the way in achieving HEARTSafe community status. So first, let's look at what sudden cardiac arrest is and why we would choose to approach it in such a unified and community effort. While cardiac arrests and heart attacks are linked, they are not the same. Where a heart attack is a circulation problem, so usually caused by a blockage, cardiac arrest is an electrical problem, and sudden cardiac arrest, as the name implies, happens suddenly, many times without warning. So the really important thing to note here is that sudden cardiac arrest can happen to anyone at any age, at any time. Here we can see the data for the average number of out-of-hospital cardiac arrests that happen annually in the United States, as well as the approximate number of cardiac arrests that were responded to by first responders in Indiana statewide, and then also the Porter County numbers there. The two most important things to note on this slide are that in the case of sudden cardiac arrest, nearly 90% of those who experience an arrest do not survive. However, as indicated here, and as we'll see on the next slide, with early CPR response and AED use, the chances of survival increase dramatically. So as mentioned previously, sudden cardiac arrest is a serious problem, but the good news is there's an intervention that has proven successful. The American Heart Association has described, and the Citizen CPR Foundation has depicted for us, the chain of survival that begins with a call or an express directive for someone else to call 911 and grab an AED if available while CPR is started. If an AED is available, the AED is used and CPR continued as necessary until EMS arrived to take over, followed by hospital transport and care leading to recovery. During an arrest, the use of an AED within 4 minutes increases an individual's chances of survival from around 10% to 89%, An AED used within 3 minutes, the chance of survival goes up to 74%. And within 1 minute, there's almost a 90% chance of survival. So I think we can all agree that reducing death and disability from sudden cardiac arrest is important and something that we all want for our community, which is why you're all here. And I'm just really excited about this awesome turnout. So where do we start on the road to ensuring a chain of survival availability in our county or becoming a HEARTSafe community countywide? The Citizen CPR Foundation provides us with the following 6 community-based strategies, which provide the guidance for goal setting and strategic planning toward the 13 elements of a HEARTSafe community. And I am going to read them. So number 1, strengthen local stakeholder collaboration, which is what we're doing right now in establishing this interprofessional collaborative community team. And I bet every single one of us knows at least one other individual or group that we could call in to assist. And so we'll have an opportunity to do that as well. Number 2, encourage data collection, analysis, and dissemination. So we reviewed some of the data that we were able to gather, thank you, Tim, from a state database. However, we're going to want to adopt a solution for gathering, analyzing, and sharing local information in a more easily acceptable manner as part of the initiative. And 3, facilitate implementation of life-saving strategies. 4, promote public education and training. 5, improve delivery of high-quality CPR and post-sudden cardiac arrest response. And 6, enhance the impact of cardiac arrest therapies. So there are activities that are already being done in our community to varying degrees for all of these things. We just need to be able to determine as a team what is being done, if there are any gaps in this, our goals for expansion and improvement of what's currently being done, and a plan for us getting there. So how do we take these community-based strategies and work toward HEARTSafe community status? First, we assemble our community team. So that's what we're doing today. Next, we assess our HEARTSafe readiness, and we are going to do that in just a few minutes as part of this first meeting. And then we're going to dive into some individual activities that we're going to ask everybody to help with over the next 4 weeks ahead of our second meeting. Then we apply our local data and assessment information to the 13 elements of a HEARTSafe community, set goals for each, and plan to reach these goals. And we will do that at our next meeting. So our ultimate goal as a HEARTSafe community is to engage the community at all levels, connect citizens to first responders, and enable bystanders to be willing and prepared to act. So the next 2 slides are over the 13 elements of a HEARTSafe community. So our first is to establish a high-performance lead agency and community team. The health department has agreed to serve as the lead agency, with the Valparaiso Fire Department assisting. And thanks to each and every one of you, we have our community team assembled. And again, we can add to that. We'll talk about that in a little bit later. Number 2, use data to drive local strategies and tactics. We discussed that we'll use the 2024 data that we have, as well as current year data, to drive our decision-making and strategic planning. We can also use census information through our GIS program, and we'll discuss this more as well a little bit later and at the next meeting. Number 3, train citizen responders. And number 5, educate citizens on how to respond to sudden cardiac arrest. These really go hand in hand. Many of our organizations are trainers of hands-only CPR, citizen CPR, heart saver CPR, AED, even basic or advanced life-saving. We can use this to strategically expand our heart saver CPR training and our community information and awareness campaigns. 4, recognize and celebrate the actions of rescuers. So I believe we're going to discover this is being done by each responding department at the time a response is made. Our team and our strategic plan will allow us to determine the most impactful recognition and celebration and ensure that all responders are celebrated in that manner. 6, train emergency communication center staff in telephone CPR and AED use. I believe that we'll find, and we'll go through this in our assessment a little bit, that this is probably something that already has been done and is done on a regular basis as staff come in and as regular maintenance. 7, plan for and practice responding to sudden cardiac arrest. We will establish guidelines and frequencies for these drills or practice responses. For example, October is Sudden Cardiac Arrest Awareness Month, and 10/16 is National Restart a Heart Day. So these are great benchmarks to build out practice schedules from. 8, strategically place 24/7 accessible AEDs. Locating our current 24 accessible AEDs will be one of our first team tasks, and we will work toward this through a Google Sheet and a community team workspace that will be provided after this meeting, and we'll go through each of those documents. 9, establish a 911 integrated AED registry. We will begin, and I believe our dispatch is already doing this, by placing all locations into our dispatch CAD system, as well as placing them into Pulse Point's AED locator, with an overall goal of possibly implementing Pulse Point's responder app, and we'll discuss this more as well. 10, equip first responders with AEDs and teach them to use and maintain them. We will assess where we currently are with first responder AED accessibility and make a goal and determine a plan to work toward it. 11, train EMS clinicians in high performance CPR and resuscitation. Again, this is something that I think we will find largely or completely is being done, and we'll talk about this in our assessment. 12, establish a process for quality improvement and annual reporting. So with every intervention, there must be a plan for evaluation and continuous quality improvement, as well as a platform for reporting and distributing data. We will decide these methods together as a team within the strategic plan. And 13, develop health promotion and prevention programs for sudden cardiac arrest. Again, many programs exist within our community. We'll identify them, evaluate their availability and accessibility, identify any gaps, and make a plan to fill those. As you can see from reviewing the 13 elements of a HeartSafe community, many of these are already in place in our community. And together, we're able to make a plan to expand the programming that's already happening, the resources that already exist, and work to fill any gaps that we may identify to increase the reach of our chain of survival. So what are we asking of our community team? So we're looking for, this is meeting number 1 today. And we are 1 slide away from being done with this presentation. We're going to slide into the community assessment after that. And then we will review the different documents that you'll receive in the follow-up email and what we're asking there. That's all that second point, the post-meeting 1, pre-meeting 2. It's a Google workspace that I will send the links to everything for. We're going to collect contact information. We're going to collect information on AED locations, training and awareness efforts. And we're asking that that information be put into those documents by October the 13th. Also in that email, we'll send out a link to vote for the best meeting date and time on the week of 10/20 for our second meeting. During our second meeting, we will use the results of all the information that we've gathered from everyone, as well as our community assessment and the goals that are required for each element. And we will develop activities that will then be written into a strategic plan. And then we'll break into work groups, and we will ask people to work within their work groups. The great thing about this is we don't have to work on it one element at a time. We can work on all the elements all at once, broken into smaller groups, and it makes it a lot more attainable. Again, we cannot thank you enough. And for those of you that are a little bit competitive, I just want to throw this out there. For some of you, I had written in an email that I sent out ahead of the meeting. LaPorte, the city of LaPorte, attained HeartSafe community status. I believe it was the spring of 24. And their county is also working with their health department to achieve status countywide. So if you're a little bit competitive, and we can build off of that, if we achieve HeartSafe community status countywide, there is no other county in the state of Indiana that's HeartSafe across the whole county. So we would have the opportunity to be the first. And these are just my references for right now. And before we move on from here, I want to find out if anyone else from the health department or the Valparaiso Fire Department or Teresa, if she's jumped on, have anything else to add, anything that I missed or glossed over as far as the presentation goes. Nothing, are you sure? Okay, does anybody have any questions or comments that you would like to make otherwise? You guys are a quiet group. I am going to go ahead then, and I'm going to reshare my screen. And this time what I'm going to put up for the community assessment, this is the document that they have us use every time we do an assessment. And as we move through each of the elements, we will assess multiple times until we achieve a status where we can have them come in and do their evaluation before giving us the HEARTSafe community status. So what I'm going to do is I'm going to put up those progress scores defined, because I think that's going to be the easiest thing so that people can look at them. Okay, can everybody see this sheet in its entirety? Okay, so this is how they rate each of these, and we are required to do an initial assessment, but please know that for most of our elements, we are going to be at that 0.5, because even though we have a lot of these activities going on throughout the county, we haven't yet gathered all that information together, formed our teams that are going to do that assessment, made our activities to work toward those, and developed our plan. So that still puts us for most of these at the intent to participate level, with the exception of element number 1, and also maybe some of our dispatch and EMS training. So I'll really be asking for some help when we get to those. But what I'm going to do is I'm going to leave this page up, and then I'm going to read from the assessment pages so that you guys can look at what we're being asked to score as I'm reading what it says about each of the elements and the goals. So element number 1 is establishing a high performance lead agency and community team. So what it says about this is sudden cardiac arrest is a communal problem and local issues demand local solutions. As such, a lead organization is necessary for overseeing and coordinating localized HEARTSafe efforts. The lead agency takes ownership of the project and enlists help and representation from multiple agencies and individuals, as well as the community at large. Most often, a public service agency or healthcare institution will assume the role of the lead agency. So the goal is a lead agency and community team is established with broad representation from the community. And I had this at a 1.5 or a 2. So please, first of all, let me know if you agree with that and which one should we choose?
Well, I was already at a 1.5, and because we're meeting, wouldn't that put that at a 2?
That was also my thinking, Todd. Do you guys agree? Does anybody have any differing opinion? I'm going to call that a 2. Oh, I see chats. Okay, we've got agrees. Tim agrees, so it has to be true. All right. Now, as we roll into these other things, a lot of these are going to be at 0.5s, like I said before. So I'll tell you what, just holler at me if you disagree with me. Element 2, using data to drive regional strategies and localized tactics. It's nearly impossible to improve something that isn't measured. With this in mind, the Citizen CPR Foundation, with vast support from partner organizations, calls for the community to develop a plan for the collection and analysis of cardiac arrest data. Enrollment and participation in the Cardiac Arrest Registry to Enhance Survival, or CARES, is strongly and highly recommended. CARES helps communities measure performance and identify how to improve cardiac arrest survival rates. In those cases where participation in CARES is prohibited for any reason, locally developed and compatible methods are acceptable. So the goal is a process has been put into place for the collection, analysis, and use of cardiac arrest data to measure performance. Now, CARES is something that we talk about a lot at the local health department level, because currently it's being offered to all responders or EMS in Indiana for free through the end of 2026, with hopes to continue that capability beyond 2026. And so that is something that we can talk about at our next meeting. But I just kind of wanted to throw that little bit of information out there as well. And we have the contact for that for our area who does the presentation and explain how it all works. And it should completely integrate with your response system. But I have that at 0.5, our intent to participate, just because we haven't developed a strategic plan for how we're going to do these things. Element 3, train citizen rescuers. Building on local coordination, data collection, and analysis, citizen CPR training plays a pivotal role in improving outcomes. Ideally, the entire citizenry is adept at recognizing cardiac arrest, has some forms of hands-on experience, and is willing to perform CPR when called upon. Realizing the importance of bystander actions, this element calls for a minimum of 15% of the community population, that is 26,000 people, to receive some forms of hands-on CPR training on an annual basis. Yes. All forms of training are acceptable, including hands-only CPR, as well as certification at any level from any nationally recognized organization. Views of approved ultra-brief instructional videos produced by the American Heart Association and the American Red Cross can contribute to your community's 15% goal, but are not intended to replace valuable hands-on experience. So this is something where we can use that narrative, what all we're really doing. And as you guys will see, I'm asking everybody to fill out a database that tells, what all you offer and then how many people you've trained in 2025, because we can use that information and we can kind of see from there, okay, how do we want to supplement all this stuff to get to that? And remember, there's retrainings and things like that too. So we got this, but 0.5 right now. 4, recognize and celebrate the actions of rescuers. Recognizing the actions of those who come to aid another person in their ultimate time is essential, can help and promote your life-saving efforts and reinforce desirable behaviors. This positive reinforcement can take on many forms, such as lapel pins, plaques, survivor rescuer events, and more. The key is to formally recognize all those involved for their efforts wherever and whenever possible and appropriate. A positive outcome is the goal. However, it is important to recognize bystander actions, even in cases of poor outcome. In addition to forms of recognition provided by local authorities, several organizations offer acknowledgement, which that's easy because we can all put it out like on social media and press releases, things like that. The goal is a formal recognition process is in place for celebrating of life-saving efforts. And again, when I got to this one, I started thinking of things. And so I started making notes. So please make notes about anything you guys think would be a good idea as far as activities towards these things, because again, we'll be collecting that between meetings to help jumpstart us on our next meeting when creating those activities to become a strategic plan. And I know many of our first responder agencies are doing this. Tim and I kind of talked about some ideas for, say commissioner recognition for everybody, in the same manner to make it even bigger. So 5, educated and responsive citizens. Element 5 calls for the community to develop and implement strategies to increase public awareness of sudden cardiac arrest, the encouragement of bystander intervention, and public support for your life-saving campaign. Examples include public demonstrations with hands-on practice, improving access to certification courses, utilization of social media, and ultra-brief instructional videos, billboards, newspaper articles, and other innovations. Awareness campaigns are one of the most popular, effective, and flexible ways to improve interest and awareness among citizens, as well as educating your public regarding sudden cardiac arrest. Your awareness campaigns can be organized to exploit existing national awareness months, such as National CPR and AED Awareness Week, Sudden Cardiac Arrest Awareness Month, which again is in October, so I'll be sending out a social media toolkit, and World Restart a Heart Day, October 16th. Plan around these timeframes to capitalize on the exposure and increase general interest. So goal is a public awareness campaign is established and sustained through the year using a combination of tactics. So again, at that intent to participate at this time, but kind of be thinking about ideas for things that we can do there in a unified manner. Okay, so 6, this is where I need some help. Telephone guided CPR and utilization of AEDs. Telephone CPR or TCPR can significantly improve bystander CPR rates. In order to meet this requirement, we call for your emergency communications center or centers to have committed to provide effective TCPR in accordance with the American Heart Association telephone CPR program recommendations and performance measures. In those cases where a community does not yet have TCPR in place, the Citizen CPR Foundation requires community leaders to engage with local and state authorities to enact enabling regulations to support TCPR. The American Heart Association and American Red Cross are likely partners in any efforts to get legislation on the priority list in your geography. Dispatch assisted AED locating and coaching, or TAED, an evolving strategy involving telephone guided by emergency telecommunicators in the retrieval and use of nearby AEDs. So it talks about this time there's limited research on that. So Debbie, are you able to? Okay. She says they have both certifications now, hands-on and TCPR. So where do you guys think that puts us? Because this is all about evaluation and reevaluation. That's what I was trying to figure out. Is it new, Debbie? Would we do 2, but evaluation has not yet begun?
Well, we're all currently TCPR and hands-on certified, so that's everybody when that's a requirement for training.
Okay. So it's more than implementation. I mean, it is implemented. Yeah, this is where I don't understand this assessment because it's the first time we're assessing it. So I'm not exactly sure where to put it.
I mean, if we're I'm not exactly sure I understand the entire thing, but if we're already, all of our telecommunicators are hands-on and TCPR certified, then wouldn't that element be, sustainable 5? I'm not sure.
Yes. Yes, that's what Tim says and Jeff both. Okay, thank you guys. That's where I needed help just because we hadn't reassessed it, but thank you. Perfect. Element 7, planned and practiced response to sudden cardiac arrest. Schools and municipal centers have fire sprinklers, fire suppression systems, fire alarms, and fire extinguishers and drills are often required by law. The same should be true for AEDs and sudden cardiac arrest. Schools, municipal buildings, businesses, and public venues should have a medical emergency response plan that addresses the immediate need for medical assistance in the event of traumatic injury or illness, including sudden cardiac arrest. In addition to having well thought out and written plans, periodic drilling should occur in order to validate the plan's effectiveness and identify areas needing improvement. A comprehensive emergency action plan or emergency response plan is critical to facilitate a rapid and effective response. Cardiac arrest should be suspected in any person that collapses suddenly and is unresponsive. All potential responders to a collapsed person should be trained in the recognition of SCA, cardiopulmonary resuscitation, and use of an AED. AED should be accessible on site with the target collapse to first shock interval of less than 3 minutes. The plan should be written and a coordinator should be designated to foster compliance with training, practice, and rehearsal of the plan at least once annually. Different locations may require special consideration. So the goal is for emergency action and emergency response plans in place for all schools, municipal buildings, businesses, public venues, and tested through drills at least once annually. So this, all Portage and Chesterton schools I know have HeartSafe community site designation through Project Adam, as does the Porter County Administrative Building. So if there are any others, we will want to locate those and then working within those groups, hopefully expand that designation for the remainder of our school buildings, our municipal buildings, and other businesses. So if anybody knows of any others, we'll also be collecting that information. But for right now, we'll put that at intent to participate. If you guys don't agree with any of this, you let me know. Element 8, strategically placed and 24/7 accessible AEDs. Element 8 addresses the permanent placement of AEDs in public or private congregate areas where there's a statistical likelihood of sudden cardiac arrest, such as shopping malls, supermarkets, theaters, health clubs, parks, recreational centers, transportation centers, and other venues. Additionally, the Citizen CPR Foundation recommends AEDs are accessible at all times, particularly those placed at athletic fields, parks, beaches, and public gathering spots. Consider outdoor AED enclosures, which make life-saving equipment accessible to greater numbers of people 24 hours a day. So again, we've started a really great spreadsheet of AEDs, and we do have some 24/7 outdoor Safe Heart stations as well, and a couple of others throughout the county. So we'll be looking to collect information on whether there are any more of those, and then seeing what our plan would be to expand that and improve that. But again, at the intent to participate point at this time. Element 9, 911 integrated AED registry. Automated external defibrillators are proven lifesavers. In an effort to enable their utilization, Element 9 requires the community to establish or participate in an AED registry where AED locations are mapped and integrated with the 911 system and or local public safety answering point. AED registries serve as the backbone for many novel solutions developed to facilitate rapid identification of the nearest resuscitation-ready AED in an emergency. AED registries holding information on location accessibility may facilitate AED retrieval by enabling rapid identification of the nearest device. Integration of this data with the 911 system is essential. By doing so, bystanders can be directed to nearby and accessible AEDs by emergency telecommunicators, reducing time to first shock. Mobile device applications such as Good Sam in the United Kingdom and PulsePoint AED in the United States can crowdsource the development and maintenance of AED registries. Both apps allow users to photograph AEDs and upload their location so they can be verified and added to the local AED registry by emergency communication centers and systems. So the goal would be to establish a 911 integrated AED registry and means for identifying and adding undiscovered and new AEDs. So for this, the PulsePoint AED registry does have a registry, which is a free app, and citizens can get that, and we can upload different locations in there. They also have a paid app, which is PulsePoint Responder, that would actually alert you of an event happening through dispatch if you were someone who was trained and had the app and were close enough to respond to that. And so that is something that we will kind of talk about as we're making our strategic plan. And I know Tim has talked to a lot of the first responders. I know we've talked to Debbie. He's talked to Debbie a lot. And so we will kind of talk about where we're at on that and kind of where we want our plan to take us on that. So for right now, we're at intent to participate. Did anybody have anything to add about that? I saw Jen asked if anybody was using it in Porter County at all.
I can speak to from the 911 perspective. We have our CAD has a kind of a flag that's called premise hazards. So every time we get, and we've been doing this for years, every time we get any AED location, we add that to the specific address. And so it's attached to that location in CAD, which comes up for all dispatchers. After talking to Tim and researching PulsePoint a little bit, I recognize the benefit of expanding kind of creating essentially a little geofence around each AED so that responders or the public is aware of where they're at, aside from their flagged specific location in CAD. So I think we're on our way there, and I think PulsePoint will only enhance that.
Thank you. And with your CAD system right now, if an individual called in with that location, then that would be part of the telephone AED guidance could be done through what we have now, correct?
Correct.
This is Rich. I'm also with the Porter County 911 Center. And I'm the one that adds those premise hazard notes. Part of the difficulty, and I don't know where we're going with the group. A part of the difficulty, if a 911 caller calls in, there's cardiac arrest, and we say within 500 feet there's an AED. Part of the problem we have is these AEDs are seasonal, like in the parks. They're only there during the summertime, not the wintertime. So we don't know exactly when they're removed or when they're put in. Some of them are in locked buildings that we can't get to after hours. So those are parts that we would like to also include in our notes that say, hey, there's an AED within 500 feet, but the building's closed, so we can't use that one. So those are some of the difficulties that we're working through, trying to figure out.
Yeah, and that's with Pulse Point, it's a picture that you add, which would help a little bit with that. But then as well, Rich, to your point, as we're collecting this data, we'll put in there for individuals to put as much information as they can, because precise location is, important.
I think to add to the Pulse Point conversation is that you can have a locked cabinet at a park where you had your AED and maybe stop the bleed or a Narcan kit or an EpiPen, or people are using them for all different types of life-saving equipment now. But when you call 911, 911 can say, hey, I'm here, and they can say, okay, the code is 621. So then people can get into the code, which is some of the things that we've talked through when we've been talking in other areas about obtaining that Pulse Point app. And it's beautiful because it does a lot of this tracking for you, which is amazing.
Yeah, and anybody can put an AED in there, right, Jennifer? And then it just has to be validated.
Yep, it does. And I think it's super nice for, again, not only cardiac arrest, but I think looking at the multiple reasons why somebody needs emergency medicine, help.
Right, stop the bleed, Narcan, yes.
If I can just expound on what Rich said, it is important. I get where everybody's going on this, but we'll probably have to determine collectively how we want. There will be some that will inevitably be inaccessible to the public. Like we've got AEDs obviously in 157, but if there's a cardiac arrest after hours in the parking lot of the bank across the street from us, knowing the location of the AED won't do the public any good because the building will be locked. So, if there's a code like you had spoke of, absolutely putting that code there. But also if there are AEDs that just aren't accessible during, whatever hours, we'll need to flag those as such.
Sure.
I just want to add to this. So Porter County Health Department has put in 3 safe stations that will be up and running 24 hours a day, 365 days a week. It's weatherproof, I guess you can say, temperature controlled. So those are out and about. We have 3, and we have 2 more that we're going to place as well.
Thank you, Crystal. Does anybody have anything else for this? Thank you, guys. Right, element 10 is first responder defibrillation. In many communities, equipping and enabling first responders, such as police officers and firefighters, can significantly reduce time to first compressions and first shock. Accordingly, element 10 calls for first responder agencies to be defibrillator capable, undergo appropriate training, have device maintenance plans, dispatch policies, event debriefing, and medical direction. Firefighters and law enforcement officers are often able to deliver defibrillation in significantly shorter times than emergency medical services. EMS systems should review the response times and consider instituting first responder defibrillation as one means of reducing defibrillation intervals. So the goal would be for first responder agencies to be AED capable, undergo appropriate training, have device maintenance plans, dispatch policies, event debriefing, and medical direction. So for this, I think probably being the capability of each officer who have one in their car would be the biggest, right? The biggest roadblock to this as far as the cost of AEDs. But we do have quite a few first responders, I believe, that have AEDs, and many groups are working toward adding them. As far as training, Is that something that all of our departments do already? I have a feeling it is.
Training on AEDs, Carrie, specifically, or
Yes.
CPR training? Yeah, Porter Stark does all that for our folks.
All of our VU officers are trained on AED, and we carry them in the marked units. And we have about 45 on campus.
That's great. And then do you have all of those locations, Chuck? So like when we go to put those into our spreadsheet, you'll be able to put all those locations on there on campus?
Yes, we have them. PD does a monthly check on them all, so we've got that pretty dialed in.
Awesome.
Gary, I would say currently we're at a 4.0 in the county based off of first responder AED equipment.
Okay.
Because there are a lot of police officers that have them in their vehicles, not all of them.
Sure.
But every ambulance, fire truck, and all that has them already.
I would agree with what Tim just said. For Valparaiso, we have, I'd have to double check the numbers, but I think it's 22 either EMRs or EMTs, and every single one of them have an AED in their car at all times. And then we're working towards a goal of getting an AED in every police officer's vehicle, at the very least our patrol officers that are out on the road. And we're hoping that that'll be done in the next month or two.
This is awesome, you guys. Awesome.
Caroline Martin with Cleveland Cliffs. Do you want the tracking from our private businesses as well? I mean, we are a closed facility, but I believe every single one of our divisions has AEDs in that, as well as we have our own emergency services here. And of course, they have them located on in their vehicles as well.
Yeah, so that is something that we would want to track just because of the large employment population, even though it's a closed campus. Just your ability to respond, if you do HEARTSafe or CPR training, even if you do it like in-house with the rest of your employees,
Yeah,
then that's go ahead, I'm sorry.
Yeah, no, that's part of our annual safety training for all of our employees. So we have over 4,000 employees.
Yeah, and that's amazing. So that's, just kind of knowing that that's, you guys are prepared up there. And if you have your emergency response plan, that's all part of working toward the goals of the whole county. Thank you. Does anyone else have questions along those lines? Give me just a second. I'm so sorry. I seem to have lost elements 11 and 12 in my paper shuffling. Element 11 is high performance resuscitation. Among the essential components of a system of care for cardiac arrest victims is high performance CPR. High quality resuscitation and improved outcomes are highly dependent on a foundation of high quality CPR by pre-hospital care providers. Advanced cardiac life support must be positioned in a way that does not get in the way of, but instead enables this high quality CPR. The approach requires a team approach by EMS systems, agencies, and providers alike. High performance CPR can boost survival outcomes significantly by ensuring that victims receive enough blood to their heart and brain. High performance or high quality CPR is an expectation for all those who are responsible for the delivery of professional resuscitation. Recognizing the value of high performance CPR, the Citizen CPR Foundation recommends that the local EMS providers experience or practice high performance CPR and possess supportive protocols, technology, and equipment for resuscitation and effective post resuscitation care. Performing high quality CPR with minimal delays and interruptions is a core strategy to improve outcomes. Quality improvement strategies should aim to encourage, enable, and direct the ongoing practice and pursuit of high performance CPR. So the goal is for emergency medical services providers to practice high performance CPR and possess supportive protocols, technology, and equipment for resuscitation and effective post-resuscitation care. So Tim is giving 5s. And we've got thumbs up. All right, love that. Anybody have any other comments or discussion on that? 12, quality improvement in public reporting. Further to element 2, data collection and analysis, element 12 focuses on EMS provider agency QI, quality improvement process for cardiac arrest that includes data review, facilitated debriefing, access to patient outcome data, and active medical direction. Additionally, these criteria call for public reporting performance and survival data by the lead agency. The goal here is to measure and improve, as well as transparency in the improvement of support by the community. So goal as a process has been established for continuing quality improvement and public reporting of cardiac arrest data on an annual basis. So for this, I have us starting at the intent to participate. Does anybody have anything different for that? Okay, and finally, element 13, meaningful primary and secondary health promotion and prevention. Cardiac disease results in millions of deaths around the globe annually, most of which are avoidable if identified early. Preventative health care has a major role in the fight against cardiovascular disease. Primary prevention refers to the steps taken by an individual to prevent the onset of disease. This is achieved by maintaining a healthy lifestyle choice, such as diet and exercise. Secondary prevention focuses on reducing the impact of the disease by early diagnosis prior to any critical and permanent damage. This facilitates avoiding life-threatening situations and long-term impairments from a disease. The adage, an ounce of prevention is worth a pound of cure, is reflected in element 13. This element addresses the need for the community to establish primary and secondary public health measures that support cardiovascular wellness, as well as education, prevention, and systems of care for stroke and myocardial infarction. So the goal is meaningful primary and secondary health promotions are in place and tailored for the community. So again, I know that we're doing a lot of these things, but as far as achieving activities to fill the gaps and things, I had it at an intent to participate. Does anybody have anything different for that? Does anyone have any questions, comments, or concerns about the community assessment?
Just one thing, Carrie, the
Yes.
element 12 is technically 2 things, and most EMS agencies do some type of quality improvement meetings once a month or once every couple months. So most EMS agencies are already doing that part.
Okay.
It's the CARES registry, I think, that is the data reporting part. If you guys as a lead agency are going to be able to see that data.
Yes.
So
yeah, so we would be, of course, working with you on the, what you're kind of doing for the QI part as far as implementation and wraparound. But then, yeah, you're right. As far as making that publicly accessible, that would be us. It is all the different EMS groups, though, that have to enroll in the CARES registry. Like, we cannot enroll in CARES, but we can do like a dashboard to make the information publicly accessible. Does that make sense?
yes.
Okay. Is that what you meant, Tim?
Yep.
Okay. Yeah, and with this assessment, I mean, these numbers are so confusing because so many of the things, we do have things in place in our community. But as far as the goal and establishing the activities and, establishing the work group and things like that, that's where it puts us back at that 0.5 for so many of those things. But it's awesome that we have a jump start on others. So Anything else about the community assessment? All right, so the last thing that I wanted to do really quick, I'm going to stop sharing this screen, and all of these things are going to be sent to everyone. So I will put in the numbers that we came up with today and a few notes on this document, and then it will be linked in the email that you will all get tomorrow. So I'm just going to very quickly share what that email is going to look like so that you guys can see. Oh, that's not what I meant to do. Okay, so tomorrow everybody will get an email thanking you for being here. There will be a link to this video. It'll be a YouTube link, but only those of us who are on the contact list will receive it. It won't be a public link. We have a spreadsheet for contacts. And so in there, everyone whom I reached out to, name and email are in there. If you prefer a different email, if you want to provide a phone number, if you already know what element you want to work on a work group with, that's all in that spreadsheet. If you have somebody else you think should be added to our list, please add them at the bottom. There's a heading for additional individuals to invite to the team. So please list them there. Underneath here, I will create a doodle poll for our next meeting. We're shooting for the week of October the 20th. So we'll give everyone until the 13th to fill in all the information that they have on the different spreadsheets. And then the week of the 20th, we'll shoot for a meeting. I know fall break is so spread out across all the schools. So like one of the schools, it's that week of the 13th, 14th, and then there are schools that have it the following week, and then there are schools that have it the following week. So I didn't really see any way to avoid fall break, and I apologize. So hopefully we can put a lot of days in there and we can find a good day for that second meeting. The next link is for AED locations, and I'm going to jump into the Google Workplace as well because I want to show everybody what these look like. And then in addition to those links for things that we're asking people to put information in for so that we can kind of assess where we are, the HEARTSafe Communities Resource Guide from the Citizen CPR Foundation. So the guide we've been using and pulling all this from is attached there in that link as well. And for each element, they give resources for the element. So once we break into work groups, this is going to be a really valuable resource. We also have already contacted them to let them know that we have an intent to apply. And we have a meeting with our liaison the first week in October. So they are very hands-on throughout the process. So at any time, if anybody needs a contact with his name is Dave, let us know. We'll share that information out. Again, I'll put the assessment that we just did right down here. We list out each of these elements and then the associated goal. And below there's a place for people to put in recommended activities. So hopefully, if you thought of something during this meeting, throw it in there. If you're just driving around or thinking while you're brushing your teeth and you think of anything, throw them in here for ideas for activities to work toward these goals. And so that will help us to really get started because we're going to have a lot of conversation at our next meeting as far as coming up with those activities. We also talked about Sudden Cardiac Awareness Month is actually in October. National Restart a Heart Day is October the 16th. So here there's a toolkit for the American Heart Association where you can share out awareness information on social and other medias. And if anyone would be willing to host or sponsor a HEARTSafe training on the 16th, that would be something that you would be willing to do. As many of those as we could offer, particularly if we're able to offer them free of charge to the community, would be awesome for that day and for working toward our goal. And then also as being a part of our group, we have special pricing through Zoll and the Zach Mago Foundation for Zoll AEDs and Safe Heart cabinets. So all this is going to be included in the email. I'm going to stop sharing this screen to jump into the Google Workspace. So I just kind of wanted to show everybody what some of these look like. We talked about the context list. It's really straightforward. This is the AED locations. And we actually shared this with dispatch so that they could make sure that they had all of those logged into their CAD system. So these are the ones that have 24/7 community accessibility outdoors. So those are recorded there. And then, of course, we had the information for all the Porter County government buildings. We know that each of the Ys has them, but I know Wendy was putting information in the chat. So I am sure that, I mean, you guys may have more than one. So this is where any information that you can go in here and add, you know, the number, the locations, as much as you can provide for dispatch, that would be awesome. We know that each of the schools has one, but again, they may have multiple. Portage and Chesterton schools may have more to add in here based on their Project Adam status. Of course, all of our fire departments, but Chris was able to reach out to some of the hospitals and urgent cares about where their locations were. But please, this is for any AEDs in our county, and any information that you can add there that will help us out. Close that one. And then the same thing for training. So I just put some things in here for examples. So for example, when Phil contacted me and said that they would participate on behalf of the MAC Foundation, he sent me trainings that they're currently doing. So I just threw those in here. But any training types that your organization does, any associated costs, and then your number trained in 2025, if you would be willing to put that in there. And I may very well be missing information that would be helpful. So please add any of that that's possible. And then the same thing with awareness efforts. So here I just threw in a couple press releases that we've done for when the Save Heart stations were put into place, because all these are awareness of sudden cardiac arrest and the need for accessible AEDs and the use of AEDs and how that saves lives. And then did that one. Oh, the primary and secondary. And again, I just threw some things in here for examples. So any of the programs, I know Powers, you guys probably have several. Same with Franciscan and Northwest Health. I know Todd, you guys may offer some things as well in different groups. So just anybody who offers or partners with anybody to offer, of course, our YMCAs as well, anything for heart health promotion, and then also that secondary prevention. And then I think the only other thing I wanted to highlight, of course, all of the resources are going to be there. I also wanted to highlight this. So each of the elements, this is what we just talked about, has a tab. So a tab for each element with what the element is, with what the goal is. So any activities that you guys have. So for example, this is our establishing a high performance lead agency and community team. If anybody can think of any additional activities we should be doing as we're working through this, please list them here. For the others, it's listed as a recommended activity. So please take some time to fill out those spreadsheets, to review the information if you want to review this video again, or from the Citizen CPR Foundation. The assessment form has all the information that I was reading off of it, and where we were at with that, and where we currently, you know, have our AEDs, have our promotion, have our trainings at, and then make recommended activities here. That will really help us when we go into that second meeting, when we're trying to decide, okay, this is our goal, what are those specific activities, and how are we going to write that into a strategic plan? So all that stuff is just down here. Did I miss anything? Does anybody have any questions about that? Or any other questions or comments in general?
I put one in the chat.
I see that. I'm sorry, I was just getting to it. So Tim was asking if we have anybody from Northwest Health EMS, South Havens, and Four Seasons participating. I know I reached out to somebody from South Haven. I have to be, Katie, for Northwest Health EMS, who would be our contact for that?
I can get you that information.
Thank you.
Yep.
And then I can definitely follow up with South Haven. Tim, do you have a Four Seasons contact?
I don't, but Debbie might be able to get you that.
Oh, yes. Sorry. Thank you.
I'll get that to you, Carrie.
Thank you. And then I will follow up with South Haven as well. And and I apologize, I can't remember right off the top of my head. Is possible that he let me know that he was not going to be able to make it and will watch the video. Okay, so Amy had a question about AED locations, and this is a good question, so please weigh in. Do we want to add number of AEDs at police departments with description of each car having them, or where at the station they're located? I think, tell me if I'm wrong, but for cars, just the number located in car, and if there's any, so like let's say there's 40 cars, but there's only 25 on the road at a time, and each car checks one out, or so like that kind of information would be information we would want to know. So basically we're just looking for how many out on the road have an AED as far as cars go. Does everybody agree with that? Would you guys concur? Okay, and then as far as in the station, I guess just how many are in the station and where they're located. These are great questions, you guys. Thank you. So do we think reviewing that and putting as much information as everybody individually has into the sheets by the 13th is doable?
Yes.
Thank you, guys.
I think so.
Ellen asked a question about what kind of information we want from the jail. We had information from a survey, Ellen, that we did last year. But Crystal was just talking to Phil today about a new AED program, maybe that you guys are starting or wanting to start or doing. So the information that we had previously is in the spreadsheet already. So if you just want to review that information, and if anything is different and or on the horizon, add that. Is that doable? Perfect. And then the MAC can also, Tara had put in there, I apologize, above in the chat, if anybody needs hands-only CPR, heart saver, BLS, you can contact her at the health department. And then also the MAC Foundation offers community classes, can register for, and private classes that you can book. So to reach out to McKenna. We have such a great group. I'm super excited, you guys.
All of the Porter County Library branches, we have 5 branches across Porter County, can be possibly can be some great host sites. If we got down the road and we were looking at, well, how do we get that 26,000 citizens trained? Just keep that in mind. We don't have any experts as far as the trainers, but our branches can make some great larger training spaces across the county. So.
Thank you. And then Christy said that the YMCA in Valpo also offers CPR classes. And Tim had asked me about an update on the grant. So the health department, Chris is our grants and contract specialist on here. They did apply for a community foundation grant for the Pulse Point responder implementation cost. So that's not something that we have heard about yet. So we will keep everybody in the loop about that. And then obviously with that information, we would know whether we have the implementation costs, and we can discuss plan for sustainability for the annual cost from there. And we do have a potential plan in place that was a part of the grant. So that's something that we can keep everybody updated on. And then Melissa from the Community Foundation says they also have space available for trainings.
I'm sorry if if this has already been covered or we referenced a point person. What about the schools? Schools have AEDs. They also train teachers. Do we have anybody represented in this group that would kind of chair that group just across Porter County?
Hi, this is Joy Sunday.
Joy! Yes, Joy. There you are.
Thank you for volunteering me. I appreciate it.
Always willing to help you out over there.
Yeah, we'll do what we can do to help also. And we do have a couple instructors here within the school.
Wonderful. Thank you. Yeah. And I know like with Chesterton and Portage as well, going through Project Adam for all of their sites, being able to help, because I'm sure, and Joy, it would seem overwhelming as a school, like, wait a minute, I have to have this emergency response plan, and we have to, have all these AEDs and practice it, all things that you most likely have in place. It's just kind of going through the process, right?
Correct. Even just with Project Adam, we are doing most of it. It's just, we're not putting it on paper. So that's something we need to, work on. We certainly will, and we have talked about it. But we were just looking to see what other options are also out there.
Sure. And Crystal just put in the chat that Union Township contacted her yesterday to get Project Adam started. And Crystal was our point person when the admin center did it this summer. So she obviously can help and guide with any of that. And she actually just returned from the Project Adam conference as well. It was through Friday. And so she's actually gotten to know our local person really, really well. So lots of offerings for trainings for Stop the Bleed and Narcan as well from Franciscan. Physical and mental health first responder classes. That's awesome. Powers Health also has a room, says Lisa. So this is awesome. And then IV Tech Valpo, their paramedics program. Does anyone have anything else? Any other questions, comments, concerns? I will save the chat. I will try to save the chat. Oh, yes, I can. All right. Well, if nobody has anything else, I will get this recording over to Demetrius to put onto YouTube to send the link. And tomorrow I'll send out the follow-up email. If anybody has anything between now and then or afterward, let me know and we can get it addressed in that or later. Thank you guys so very, very much.
Thank you, Carrie.
But if you put it in there,
Thank you.
it'll